So, after we discussed our historical perspective in nursing, I hope by now you were able to realize that nursing had already gone a long way. And so, right now, we are reaping the hard work, the efforts of our nursing leaders. So, at this time, we are going to take a look at the contemporary nursing practice of our time so that we'll be able to know how is nursing defined, who are the recipients of our nursing service, what are the scope of nursing, the settings for nursing practice, and what are the different laws or nursing practice acts governing our profession. We will be discussing that today. So, the first definition of nursing that we had was that of Florence Nightingale, wherein she said that nursing is the act of utilizing the environment of the patient to assist him in his recovery. So, we have identified Florence Nightingale as our first nursing leader, our first nursing theorist, and for her, nursing is manipulating the environment of the patient. It was um, she who formulated the environmental theory. So we can see that basically for Florence Nightingale, it is really about the relationship of the patient and the environment that would assist him in his recovery. And then we have Virginia Inderson. For Miss Inderson, nursing is she said that the unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery, or to peaceful death, that he would perform unaided if he had the necessary strength, will, or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible. Comparing the two definitions, we can see that, like Miss Nightingale, Miss Anderson as well describe nursing in relationship to the client and the environment. But unlike the first definition of Florence Nightingale, Virginia Anderson saw the nurse taking care of both healthy and sick or ill individuals and acknowledged that nurses interact with clients whether recovery is possible or not. And she also mentioned about providing our client peaceful death or a dignified death. So, in comparison, both of them acknowledge the environment, but Miss Anderson also included not only the role of the nurse to assist the sick individual, but she likewise included the role of nurses in individuals who are not ill or who are otherwise considered as healthy. And then we have several nursing leaders emerging in the 20th century. They likewise formulated their own theories. They provided us what could use right now, the framework in providing our nursing care. We have Martha Rogers. So, for Martha Rogers, her theory was about the science of unitary human beings, wherein she viewed the person as an irreducible whole, wherein the whole is greater than the sum of its parts. She stated that humans are dynamic energy fields in continuous exchange with environmental fields, both of which are infinite. We also have Dorothea Orem's general theory of nursing. The self care theory is based on four concepts: self care, self care agency, self care requisites, and therapeutic self care demands. We have as well another theory by Imogen King, which is a goal attainment theory. And then we have Betty Newman's systems model. And then we have the caring theory or the curative theory of Jean Watson. So these theories have or provided us different definitions of nursing, and they're important. That is why you have a specific subject on this. They go beyond, no, the simplistic common definitions of nursing. They provide us a description of what nursing is, what is the relationship between nurses, between our profession, between the client, the environment, and most importantly, our intended outcome for the client, which is health and well being. So going back to these different theories and their definitions, wherein we have a lot, there are certain themes that are common to many of these definitions. They said that nursing is caring, nursing is an art, nursing is a science, nursing is client centered, nursing is holistic, nursing is adaptive. Nursing is concerned with health promotion, health maintenance, and health restoration. And that nursing is a helping profession. We also have definitions of nursing from the American Nurses Association, wherein um, they said that in 1973, they described nursing practice as direct, goal oriented, and adaptable to the needs of the individual, the family, and community during health and illness. In 1980, they changed this definition into that nursing is the diagnosis and treatment of human responses to actual or potential health problems. It is at this time that um, we were provided the nursing diagnosis that we use in our nursing process. And in 1995, ANA recognized the influence and contribution of the science of caring to nursing philosophy and practice. The current definition of nursing by ANA remained unchanged from 2003 edition of their nursing's social policy statement. And that currently they said that nursing is the protection, promotion, and optimization of health and abilities, preventions of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of families, individuals, communities, and population. So currently, there are a lot of researches or studies exploring the meaning of caring in nursing. And this would be discussed later on in the succeeding concepts of this course. Now, who are the recipients of nursing? We 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 commonly call them as consumers, sometimes patients, sometimes clients. So when we say a consumer, it is an individual, a group of people, or a community that uses a service or commodity. People who use healthcare products or services are considered consumers of healthcare. A patient is a person who is waiting for or undergoing medical treatment and care. This word came from the Latin word meaning to suffer or to bear. And traditionally, the person receiving health care has been called a patient. We usually call them patient when they seek assistance because they are ill. They need assistance, medical assistance from us. But this was changed into the word client because nurses believe that the word patient connotes something of a passive acceptance of the decision and care of the healthcare professional. So they want to provide a picture of the recipient of nursing as someone who is not necessarily ill and at the same time actively participating in the care provided to him or her and due to the onset of emphasis on health promotion and prevention of illness, we usually refer to our client, to our the recipient of our care as our client. Okay, so when I say client, that is a person who engages the advice or services of another who is qualified to provide this service. And in this relationship, we nurses are qualified to provide nursing service. So when you say client, this presents something more of a collaborator, a stakeholder, an active participant in the process of achieving health and wellness. In a way that connotes, when I say client, we are implying that the person is responsible for their own health. Thus, the health status of a client is not only the responsibility of the health professionals, it is the main responsibility of the individual. And that individual works collaboratively with the health professionals or the healthcare team. So most often, more at this point in time, we would refer our recipients of nursing service as client. And then, who are the uh, what are the types of clients that we have? So we have first the individual or a specific person. We have the families where individuals belong to, and we have communities as well as population groups. Um, Frameworks for nursing care are most commonly applicable to the individual, the family, and community. So, what is the scope of our nursing practice? We have four areas, that's promotion of health and wellness, prevention of illness, restoration of health, and caring for the dying. So, when we say promoting health and wellness, we define health broadly as actually the realization of a person's highest potential, or what we would often be called as actualization or wellness and well being. We promote wellness in clients who are both healthy and ill. If the client is healthy, we maintain it or we improve it. If the client is ill, we assist the client to move towards healing, at the same time, cure if possible. This could include activities that will enhance lifestyle, healthy lifestyle, such as um, good nutrition, physical fitness, preventing drug and alcohol abuse, risky behaviors, and at the same time, maintaining a safe environment. When I say preventing illness, our goal for this is still the same, to maintain optimal health by preventing disease. What are the activities here? They could include immunization, promoting prenatal and infant care, prevention of communicable diseases, sexually transmitted diseases, and many more. In restoring health, we focus on the ill client. So it could extend from early detection of disease up to helping the client during the recovery period. At this point, restoring health, we provide direct care to the ill person. We provide health care like administering medications, specific procedures, and treatments. We assist in the performance of diagnostic and assessment procedures, such as uh, measuring blood pressures, vital signs, examining um, feces and occult blood. And then we also consult with other healthcare professionals about actual or potential client problems. Then we teach clients about recovery activities, such as what they will be doing once they are stabilized or had recovered. Okay, so in rehabilitating clients, we assist them to reach their optimal functional level after being ill, either physically or mentally, or being injured. And we also have caring for the dying. This is comforting and caring for people of all ages who are dying, and that includes doing our best to help our clients live as comfortably as possible until death, and help his or her significant others, her loved ones, cope with the death, as well as carry out activities, these activities. So we can do this in the homes, in facilities, in hospitals, and we do this in agencies like in Home for the Aged, and so caring for the dying is also one area of our nursing practice.